Hi, I'm Matt Makofske, and I'm a senior healthcare analyst with RS21's Health Lab. I'm here today to give a little update about some of the work we're doing in the telehealth space. So I'm sure, as many of you know, telehealth utilization boomed over this past year. So a lot of it was out of necessity, so that patients could keep seeing their providers safely during the pandemic. A lot of it also out of convenience that maybe I need to check in with my provider, but it really doesn't have to be in person. Telehealth is easier on this one. And there's so many different ways to quantify this growth. I know for me, looking at New Mexico Medicaid data, if we look at the number of telehealth claims before the pandemic to those first few months, it grew by over 2,000% from just a tiny fraction to 8 or 9%. So much of just the focus has been on how do we scale telehealth fast. And now, as things relatively stabilize and calm, we have an opportunity to step back, look at what worked well, maybe what didn't, see what services align for telehealth really well, and also just be strategic about what's next and how do we continue building telehealth and evolving it to meet the ongoing needs of our communities. I know for me, one piece that I'm particularly paying attention to is access and equity. So like with rural telehealth, a lot of New Mexicans in rural New Mexico started using telehealth, but more in urban areas utilized it, like disproportionately more. And a lot of that in the urban areas, there's easier access to care already, access to resources, distance, access to broadband, all those things. So how can we use telehealth to keep building more and more access to the areas where they don't have that, like rural New Mexico? And just there's a lot of opportunity there. So what's RS21 doing about this? So we're building a tool, a telehealth tracking portal that allows any payer or provider to plug in their claims or billing data and quickly get insights elevated. So things like where is there disproportionately high or low utilization of telehealth, as well as what are the most frequent diagnoses, specialties, procedures, who are the patients, their age, gender, and other things like that, as well as what's happening statewide, as well as specific communities. So how can you zoom in and zoom out to see those two different levels? The tracking portal does all these things, and its goal is really to help us move from anecdotal understanding of, yes, telehealth has grown a lot, to where has it grown a lot? Where is it sticking? Where is it not? And how can we have that just data informed understanding as we go forward so we can be strategic? And also start answering those next level questions of what happened and starting to why it happened, where it's a good match, and how do we just be targeted with what's next. On other fronts, the tool can help with things like the different conversations at the state and federal government levels around regulations and funding. So where should new funding for new programming go? What about funding for broadband? Where are regulatory updates needed? It can help inform a lot of those conversations as well. I feel like I could keep talking about this all day, so I'll stop from there. But know that my team and I, we're just so excited to be a part of this conversation of helping telehealth grow and meet the needs of our communities. Because for us, it's an access and equity piece. Telehealth has so much power to pull down those barriers, and we want to help see it do that. Thanks for watching.